Within WA Health policy, SAC1 clinical incidents must be investigated using a rigorous methodology. The London Protocol is one of these appropriate rigorous methodologies. It's frequently used in WA Health as a primary framework for clinical incident investigation because it's clear, it's well structured, and it was built by healthcare for healthcare. The full title of the London Protocol is the Systems Analysis of Clinical Incidents, and it draws much on the famous work of Professor James Reason with respect to system safety. The methodology seeks to help understand the deep underlying reasons why a clinical incident occurred, so that recommendations can be put in place that make the way in which we do business more resilient. We explore these concepts in more detail in another video on the systems approach to incident investigation. One of the major strengths of the London Protocol is that it guides the investigation team through 7 key steps in conducting a thorough investigation. The first steps in the London Protocol are all about understanding what happened that led to the clinical incident. These stages involve putting together an investigation team, gathering data, building a chronology of events, and then identifying the care delivery problems. The care delivery problems are central to the London Protocol and are the very specific occurrences along the incident timeline where care deviated from accepted practice in ways that led to the near miss or clinical incident. The London Protocol is designed to focus our attention in on these specific problems and avoid the pitfalls of other investigation processes where the team might be drawn down unfruitful paths of inquiry or influenced by opinions or political motivations for change. The final steps in the London Protocol then turn to analysing each of the care delivery problems in order to understand why the clinical incident occurred. This goes beyond simply identifying that someone did something wrong. Rather, through a process of analysing the factors in the system that contributed to the occurrence of a care delivery problem, we are able to identify the gaps and the vulnerabilities in our everyday delivery of care. These gaps then become the targets for our recommendations. Using the London Protocol, we develop an action plan to change what we do to make the system of healthcare delivery stronger and more resilient. The London Protocol forces us to do more than simply say we need to remind or retrain people who may have done something wrong. It guides us through a process to create a better system of care that prevents the incident from reoccurring. The London Protocol provides the basic structure or framework for undertaking a rigorous clinical incident investigation. In practice, it is aligned with the WA Health Guidelines on Clinical Incident Management and also draws on a range of tools in the WA Health Clinical Incident Management Toolkit to assist with the investigation process. For those who will be more actively involved in clinical incident investigation, there are a range of training options, including a dedicated one-day training program that aims to develop the core skills for undertaking an investigation using the London Protocol. More details are available from your local safety and quality team.